ICU bed space is down to 0 in some Mississippi hospitals. COVID-19 and non-COVID patients are now at risk of not finding hospital rooms in some parts of the state. Now, in addition, ventilator demand is up. 12 News' Alex Love sat in as Governor Tate Reeves and State Medical Director Dr. Thomas Dobbs broke down the dangers. He joins us now in the studio with how the problems impact us. Alex?
Melanie, these numbers are coming from most of the bigger hospitals in Mississippi. Even for those who aren't down to 0, Dr. Dobbs said they may only have 1 left, though some of the blame was pointed to hospital administrators.
We continue to be in a dangerous position.
After weeks of urging that health guidelines be followed by the public to avoid hospitals being overrun with demand, some parts of the state are now there.
Today, there are 10 ICUs in Mississippi that have 0 beds available. It's become a real issue, and I've heard some bizarre anecdotal stories about people trying to get access to medical centers transferred from ERs. They just can't do it.
Many other hospitals across the state, plus the Jackson Metro, are close to being full.
In the Jackson area, of the Tier 1 and 2 hospitals that are in Jackson, there is 1 ICU bed. Just 1. That's it. In the Tier 3 hospitals in the Jackson area, there are 6 beds.
What that means is if you're in a car wreck, if you have some other trauma, there may not be anywhere for you to go. We already know that some Mississippians have had to be transferred out of state.
While stressing the public can lighten the burden on hospitals by wearing masks and social distancing, Governor Reeves and Dr. Dobbs also blame some hospitals for not holding at least 25% of their capacity for coronavirus patients only.
The hospitals didn't do what they were supposed to do the first time. And it's just, I don't know any other way to put it. I mean, that was a condition of reopening elective surgeries.
Looking at the wave behind this trend, Mississippi just 2.5 weeks ago on June 27th had 490 COVID patients hospitalized. On July 14th, we totaled 805.
Dr. Dobbs also elaborated on top of the stats we see in hospitals now that for every 500 new cases this week, it's likely that will lead to 85 new hospitalizations between now and the end of the month.